New this morning, a Daybreak exclusive. Important news here. Nearly 2/3 of Indiana's 92 counties suffer a shortage of primary care providers. Hoosiers in rural areas lack medical insurance, can experience difficulties in finding doctors, and are often forced to drive long distances to receive even the basic health care. But there's a new scholarship and partnership that will provide a long-term boost for health care in Indiana's rural areas. And with that being said, we have two guests this morning who know all about that. Joining Daybreak right now, Dr. Kenneth Britt, COO and Chancellor of Marian University, and Steve Smitherman, the president of the Indiana Market for CareSource. Both of you, thank you so much for coming on to Daybreak to share this important news. Let's get right on into it. Great. Tell us about the scholarship.
Yeah, the CareSource Rural Health Endowment Scholarship is a partnership between Marian University and CareSource to provide assistance to medical students who commit to practicing in rural areas of the state. As you mentioned, there's a significant shortage of healthcare providers, particularly primary healthcare providers in rural areas of the communities in the state of Indiana, and we feel like this scholarship will help address that issue over long term.
So speaking of long term, this question is for either or both of you. Tell us about how this can affect Hoosiers in the long term.
Well, Marian University led on this initiative about 10 years ago when we launched Indiana's second medical school, the College of Osteopathic Medicine. And we focused on this osteopathic medicine because of the majority of students who go through that program will choose primary care. So over the last 10 years, we've graduated more than 1,000 doctors. 60% of those doctors, we're proud, are going into primary care. So the underserved resources in rural Indiana allows us to partner with a great organization like CareSource Indiana to provide this scholarship so that more residents in our rural communities receive access to a high quality healthcare opportunity.
That is amazing. So explain to us, how does this provide incentive for more people graduating to practice in those rural areas?
Well, I think the biggest thing over the term of this the partnership with Marian University, these students will receive scholarships to practice and commit to practice in rural settings. And through that, we hope that we see improved healthcare outcomes in those areas. I mean, we feel like every Hoosier deserves quality healthcare regardless of where they reside. And so we feel like this partnership with Marian will allow that to happen, especially over the long term, as we can get more of these students, as Doc said, into these rural communities from their primary care side of the medical school.
And the wonderful thing about this partnership was we're leveraging state scholarships that are available to Marian University students to continue practicing in Indiana. So when you have that scholarship along with CareSource's investment, we're more poised to keep and retain really strong Hoosier doctors.
Tell us about how long this took to put together. I can imagine this was not something you just decided on a whim.
No, not on a whim. I mean, we've had the pleasure of having a relationship with Marian University for a while now, and both organizations are committed to addressing a number of healthcare needs across the state of Indiana. And during those conversations, rural healthcare continued to come up over and over again, and how are we going to address the needs of the rural communities? And through those conversations, you know, Marian presented to us an opportunity with this scholarship fund, and we thought it was just a perfect partnership, a perfect opportunity to start doing the work to begin to address those issues in the rural communities across the state.
Now we're down to the final seconds of the interview, but we must get this out because a lot of people who are hungry for that scholarship money are probably wondering, one, when are they rolling out? And two, how often will they be given to students?
Well, I know the first one is rolling out this fall.
Yep.
So that's exciting that we're going to be able to offer that first one this fall, and then continuing on through, you know, Marian's hopefully for a long time as this partnership continues on. And we would hope that as we see improvements from this, that we'll have other organizations jumping into the fray as well to help continue to address these rural health issues.
There you have it, exclusive right here on Daybreak. Dr. Britt, Steve, thank you for sharing that news right here for our viewers. It's very helpful. We'll have that online for those who may have missed the interview.